Hello, my name is Aramandla Ramesh. I am from Meharry Medical College in Nashville, Tennessee, and I am associated with the National Center for Medical Education Development and Research. So the aim of this center is to address the needs of people who are in the vulnerable population category, people who are in the LGBTQ, people experiencing homelessness, migrant farm workers, all these come into that category. Basically, what we are trying to do is to take steps into revising the medical education curriculum so that these vulnerable population have a better primary care, and also the medical students and the graduating physicians will have all the information they need in hand to treat the vulnerable population during their practice. So our center has been in existence for more than 5 years. Every year we are doing research on at least 2 topics. And one of the topics is how to improve medical education to address interpersonal violence. And interpersonal violence, as you all know, is a leading cause of morbidity, mortality, and severe mental health conditions. Unfortunately, the physicians who are viewing it view it as an acute event and sometimes as a chronic event, but not much efforts have been paid on addressing the long-term health effects the interpersonal violence will cause to a person's life. So we have conducted a systematic review of the literature using PRISMA guidelines to identify original studies that focused on how medical students are taught about interpersonal violence. And for our studies, what we did was we have used 6 databases comprising PubMed, Medet Portal, Google Scholar, CINAHL, PsycInfo, and Scopus. So using these databases, we have screened more than 1,200 articles, and we have conducted additional screening of articles to remove the duplicates, use a variety of inclusion and exclusion criteria. The inclusion criteria we used the studies were focused on mostly medical schools in United States, and the publications are in English. And we have excluded the book chapters, opinion aids, commentaries, editorials, and all those. So after screening all those, we have shortlisted 32 articles. And these 32 articles focused mainly on a variety of knowledge domains. What we did was we selected the articles in such a way that they had pre-tests and post-test. Pre-tests refer to testing the students' or residents' knowledge about interpersonal violence, and the post-test refers to after the educational interventions like seminars, workshops, group discussions, any other didactic modules. And after that one, students and residents were surveyed to the extent how these interventions were able to help them advance their knowledge in this subject area. So our survey of literature found out that teaching medical students about interpersonal violence had a positive impact on their knowledge, attitudes, and skills. And unfortunately, current educational approach fails to recognize the effects of interpersonal violence on socially vulnerable populations, especially children, older adults, women, racial and ethnic minorities, low-income people, people without insurance, people experiencing homelessness, gender and sexual minorities such as lesbian, gay, bisexual, transgender, and queer individuals, migrant farm workers, etc. All these people are at a greater risk from interpersonal violence. And we also found out that instead of examining the patients on the basis of a single episode of interpersonal violence, using a trauma-informed system of care helps, because in it, the interpersonal violence is addressed as an integrated healthcare issue. Because here in the trauma-informed care or TIC approach, it takes into consideration the life course perspective in dealing with the interpersonal violence, because of the long-lasting effects it will have on a person's overall well-being and also the mental health. Moving forward, what we plan to do is to look for studies and also to encourage studies that would tie up what students and residents learn during the course of training, and to see to what extent it is helpful in dealing with the patients in a real healthcare setting, so that we can quantify the kind of impact it had on a patient's overall well-being. So still much more research needs to be done in this subject area.